Welcome back. Well, it's pretty much indisputed in the medical community that irritable bowel syndrome can be exacerbated by stress and by the way that you're feeling emotionally. Rena, that's an area that obviously you help people with as well as the nutrition.
Absolutely. One of the first things that we ask the patient to do is to try to eat their meals in a non-stressful situation. Quite often that means taking themselves out of the workplace at lunchtime, for example, getting away from the office, finding a quiet bench in a park, grabbing a friend and going for a walk, sitting and taking the time to eat that meal so that the body can absorb the nutrients in a most efficient way. We also ask that people drink water, because taking in water also takes in extra oxygen, which is a relaxant. And when we are in a relaxed mode, we digest our foods more efficiently.
Pretty amazing, and for the medical community too, to come around to the fact that just how powerful stress is in terms of what it can do to your body, in terms of really exacerbating a problem that already exists.
Well, certainly it contributes to my IBS. When I'm in a situation where I know I have to be at a certain place at a certain time, it certainly works on me. My bowel does feel not as comfortable, but on the other side, I can feel IBS symptoms under, very stressful bad times as well as under very good times. So sometimes it doesn't really matter. I think it's very important, though, and you've mentioned it about food. A lot of people feel that they don't want to eat because they feel that it's going to bring on their symptoms of IBS. So some people don't eat a lot of food, or they eliminate a lot of their foods from their diet, which is very troubling. So it's very important that they discuss that with their physician.
Absolutely. One of the things that bothers me the most as a professional is when I will hear a client say, there was a great function, a great party last night, and I chose not to go because I was afraid that I would have a reaction and be uncomfortable in that situation. And my job is to find out what those triggers are, what a person will eat, and in what amount, so that they are able to get out there and enjoy and take part in life. Absolutely. Someone should not miss anything.
Well, getting out there is important as well. I mean, I speak to a lot of people who do not leave their homes because they're so fearful of having an accident in their car or on their way to work. They're not able to work. So this is an illness that it strikes people certainly in their teen years. You certainly see it in young children as well, but it's hitting people who are in their careers, and it's impacting their lives in such a way that they're actually, they're losing their careers. They're not able to function in society in a normal way. Suzanne's very fortunate now with a new drug that allows her to live her life normally.
I am, but when I first got ill, food became my enemy. I was scared to eat. I went 3 months where, a meal for me was sort of a sip of water and a spoon of pudding or anything soft. I would eat baby food because everything hurt to eat. So I went 3 months where I didn't want to eat and food was my enemy. And that, of course, left me in bed. It left me weak. It was just sort of making everything worse. And it was the fact that I was scared of food because I thought that whatever was going on in my stomach was because of me eating. So if I just stopped eating, everything in my stomach would stop and everything would go back to normal, which wasn't the cause.
And that's something you must see all the time, Rena. Food is the enemy.
Food is the enemy. And what we do is teach the individual to realize that yes, certain foods may be the enemy, but certainly not all foods. And in what amount will that enemy food be tolerable?
Dr. Cohen, when we talk, if we can just jump back a little bit to the serotonin, which is very interesting to think of it being in the gut, that Jeff happens to have too much of a happy gut, and Suzanne seems to have not enough serotonin in her body. We've got a serotonin booster for Suzanne, yet why is it so difficult to find a serotonin blocker that works in Jeff's case?
Well, in fact, Jeff did allude to a drug that was available and taken off the market due to a serious side effect that was perhaps unique to the development of the drug and not to the drug itself. But it did have an event in the States, and as a result, they withdrew the drug from the
What's the
FDA.
drug's name and what was the side effect?
The drug's name was alocitron, and the side effect was something called ischemic colitis in women more than men. This is where there's not enough blood supply going to the bowel, and as a result there was pain, operation, and in some cases even death. Now, whether it was directly related to the drug or not is unclear, but the company felt it prudent to withdraw it from the market. FDA withdrew it, but it has actually come reintroduced back to the market in the United States, not yet in Canada. But there is a drug out there that is available to help patients with too much serotonin, and these are getting into the realm of the antidepressants. There are serotonin blockers out there that can be very effective in the management of irritable bowel syndrome.
So taking an antidepressant might work?
Yes, in fact, we use low-dose antidepressants, not for their antidepressant quality, but for their other neuropharmacological properties. For example, in the diarrhea-dominant irritable bowel patient, we tend to use drugs like imipramine or amitriptyline. These are so-called tricyclic antidepressants, but we're not using them as antidepressants. We're using low dose to interrupt the motility of the gut, to decrease the motility and give them some relief.
Okay, we do have to take a break. Stay with us. We're back in just a moment. Welcome back. Well, it wasn't that long ago that the medical community was skeptical about whether irritable bowel syndrome even existed. Things have obviously changed since then, but I'd be interested to get sort of an historical perspective from you on how much they've changed.
Actually, the change has been dramatic. From the 50s to the present time, irritable bowel has evolved from a disorder of mental anguish to now a biological model of disturbance of the serotonin mechanisms in the bowel. And with that evolution comes understanding of the impact of diet, of lifestyle factors, psychological issues, and importantly, drug therapy. And drug therapy has to be directed at a balance of serotonin in the gut. So if there's too much serotonin, you tend to get diarrhea-dominant irritable bowel. If it's not enough, you tend to get a constipation-dominant irritable bowel. And there are a spectrum of drugs available for that. But everyone is unique, and everyone has to be treated uniquely with regard to the balance of diet, psychological issues, and drug therapy.
Because when we hear your story, someone who's suffering the way you were 3 months ago is going to think, I can take this drug and all of a sudden I'm going to be just like Suzanne up there drinking and eating pizza.
That's the thing with IBS. I think it's different for every person, and what works for me may not work for someone else. And that's why I think you need to be open about talking about your bowels and your bowel movements and sort of any changes that your body's going through with your doctors, so you can be sure to try and get the treatment that works specifically for you.
Well,
from a nutritional standpoint, you can take some control as well.
Yes, absolutely. The first thing that we ask people to do is to eat a diet low in fat and high in fiber. It's a healthy diet for anyone, regardless of whether you have IBS or not. Also, to drink an adequate amount of water to keep the stools soft enough so that they do not become so hard that constipation is an issue.
And having someone else to talk about it, because obviously it's something that you can't talk to everyone about.
That's correct. Finding somebody to talk to about this illness. It is a real illness. It has been validated by the medical community. It's not something that's in people's heads. I mean, you touched on that at the beginning of the show. It's not. It is something that's real, and it is something that really bothers people.
Thank you so much, both of you, for coming in and for talking about your personal stories, and also for all of your expertise.
Thank you.
And I'd like to thank you for watching. I'm Avery Haynes. We'll see you next time. Goodbye.